Welcome to the deep dive. Today, we're really digging into something that, well, science is shedding a lot more light on, but there's still a ton of misunderstanding out there. Tourette syndrome, particularly how it affects kids.
Yeah, and we've got a good pile of sources for this dive. Recent studies, clinical insights, expert takes that really give us a solid look at it.
Right. And our goal here is pretty straightforward. We want to cut through the confusion. We're pulling out the key stuff, what Tourette's actually is, and this is the really fascinating part, why techs happen from a brain science angle.
hmm And also how things like stress play into it, and crucially, what actually helps. The
Oh.
practical things parents and kids can do.
Exactly. It might seem complicated, but honestly, the insights from the sources are surprisingly clear, and there's a lot of actionable stuff here. So ready to get into it.
Let's do it. So first things first, what are we actually talking about?
Mm.
Defining Tourette syndrome based on our sources.
Okay, so fundamentally, it's seen as a neurodevelopmental condition, right?
Right. Precisely. And the main thing you see are tics, those sudden kind of repetitive, involuntary movements or sounds.
And the research gives us a picture of who this typically affects. Like, when does it usually start?
It does. Typically emerges in childhood, often between, say, ages 5 and 10. That's the most common window.
Okay. And is it common? What do the numbers say?
Well, according to the CDC data we looked at, it's estimated around 1 in 162 children have TS. So, yeah, more common than many people might think.
Wow, okay, 1 in 162. And I remember reading there's a gender difference.
There is, yeah. The data consistently shows boys are diagnosed something like 3 to 4 times more often than girls.
Interesting. Okay, so let's talk about the tics themselves. They're not all the same, are they?
Not at all. You basically have two main types. There are motor tics. Those are movements. Things like eye blinking, maybe scrunching the nose, shrugging shoulders.
Physical action?
Exactly. And then you have vocal tics. Those are sounds. Could be throat clearing, grunting, sniffing, or sometimes even repeating words or parts of words.
And I think the sources also mentioned simple versus complex sex. What's that about?
Right. So a simple tic is, well, simple. It usually involves just one muscle group or a single basic sound, like a quick eye dart or a cough.
Got it.
Whereas complex tics involve more coordinated movements or sounds. It might be a sequence, like touching something and then jumping or saying a whole phrase, more elaborate patterns.
Okay, that paints a clearer picture of the what. But now for the really deep part, the why. What's going on in the brain? What neuroscience insights did the sources highlight?
Yeah, this is where it gets fascinating. The exact cause isn't, 100% nailed down, but research points very strongly to differences in how certain brain areas function and communicate.
Which areas are we talking about?
A big focus is on the basal ganglia. Think of this as a cluster of structures deep in the brain, really critical for controlling movement, but also things like learning habits.
Okay, the control center.
Kind of, yeah. And research suggests that in kids with Tourette's, there might be subtle differences in the basal ganglia, maybe size, or activity levels, or how they're wired up to other parts of the brain.
And what's the thinking on how that relates to tics?
The main idea is that these differences seem to make it harder for the brain to suppress unwanted movements. It's like the brain's natural braking system for actions isn't quite as effective.
So the inhibition part is struggling a bit.
That seems to be a key piece, yes. Then there's also dopamine. This is a major chemical messenger in the brain, heavily involved in movement, reward, motivation.
Right, dopamine gets talked about a lot. How does it fit in here?
The sources suggest that the dopamine system might be, well, dysregulated, maybe overly active, or perhaps the brain regions receiving dopamine signals are hypersensitive, especially in those basal ganglia circuits.
Ah, so it's not just about having too much dopamine everywhere, maybe. It's more about how it's working in specific pathways.
Exactly. This sort of hyperdopaminergic state could lead to increased excitability in the motor pathways, making it easier for those involuntary tics to kind of break through the filters.
Okay, so we have inhibition issues linked to the basal ganglia and maybe an overly sensitive dopamine system adding fuel to the fire. Any specific circuits involved?
Yes. The research talks a lot about these complex loops called the corticostriato-thalamocortical circuits. Bit of a mouthful, I know.
Huh, yeah. Break that down for us.
Basically, think of them as communication highways connecting the front part of the brain, the cortex, involved in planning and control, with the striatum, which is part of the basal ganglia, and the thalamus, a sort of relay station. These loops are vital for regulating movement, sure, but also attention impulse control.
So really important feedback loops.
Super important. And what neuroimaging studies suggest is that the connectivity how smoothly information flows through these loops might be different in people with Tourette's.
And the consequence of that difference.
It could mean the brain is less effective at filtering out unwanted signals or urges. So impulses or motor programs that should be suppressed might slip through, resulting in a tic, like the quality control is just a bit off.
Makes sense. Okay, so it's clearly neurological, but anyone familiar with Tourette's knows stress seems to be a huge factor. How do external things like stress connect with these internal brain differences?
Yeah, that's a critical connection the sources really emphasize. Stress doesn't cause Tourette's. The underlying neurological basis is there, but it absolutely influences how much and how intensely the tics show up.
So stress can turn up the volume on the tics.
That's a great way to put it. The research is really clear. Tics often get worse, more frequent, or more forceful during times of stress, anxiety, even high excitement, or just being tired.
Can you give examples of typical triggers?
Sure. Think about transitions like starting school after the summer, or even just shifting from playtime to homework. Conflict is a big one. Or being in environments that are just overwhelming, loud parties, crowded malls, that kind of thing.
Anything that puts pressure on the system, basically.
Pretty much. And this ties into something else the sources discuss. Trying to suppress the tics. Kids often try really hard to hold them in, especially in public.
But that doesn't really work long term.
Right. It takes enormous effort and builds up a lot of internal tension and anxiety. It just delays the inevitable. And often, when the child finally feels safe to let go or just can't hold it anymore, they experience what's called a rebound,
Rebound tics, meaner.
meaning the tics come out even stronger or more frequently than they might have otherwise. It's like shaking a soda bottle and then opening it.
Someone described it like holding back a sneeze. That urge builds and builds.
That's a perfect analogy, and one used often. Many people with TS describe a premonitory urge before a tic. It's this uncomfortable feeling, could be a tension, an itch, a pressure that builds up, and the tic itself actually brings a brief sense of relief from that urge.
Okay. So suppressing it just makes that urge feel worse, leading to a bigger eventual release.
Exactly. And you can see how this cycle, feeling the urge, trying to suppress it, feeling stressed about it, the rebound takes, maybe feeling embarrassed can become really distressing. It can lead to anxiety, shame, maybe avoiding social stuff.
Yeah, that sounds incredibly tough for a kid to deal with. Which brings us to the crucial part. What helps? What do the sources say about supporting kids in managing this?
Okay, so moving to solutions. The sources point to several really important evidence-based strategies. The first step, almost universally recommended, is psychoeducation.
Which means just learning about Tourette's.
Pretty much, yeah. But for everyone involved, the child, the parents, teachers, even friends sometimes, understanding that it's neurological, that it's the brain working differently, not the child being bad or doing it on purpose.
That reframing seems huge, taking the blame out of it.
It really is. It reduces fear and stigma. It makes everyone more supportive. Then, in terms of specific techniques, the gold standard behavioral treatment highlighted in the sources is CBIT, Comprehensive Behavioral Intervention for Tics.
CBIT. Okay, what does that actually teach a child?
It focuses on a few key things. First, increasing awareness, helping the child recognize those premonitory urges before the tic happens. Second, teaching a competing response.
A competing response, like doing something else instead.
Exactly. A specific voluntary movement or action they can do when they feel the urge, which makes it physically hard or impossible to do the tic itself. So if the tic is a shoulder jerk, maybe they learn to gently tense their arm muscles by their side. It gives them an active strategy.
Okay, so they work with the urge, not just fight against it.
That's the idea. And CBIT also involves identifying and changing things in the environment, those triggers we talked about that might make tics worse.
Makes sense. What else beyond specific therapy?
Managing the environment is key, reducing stress and sensory overload. Simple things can make a big difference,
Like what?
like having predictable routines, creating calm-down spaces at home, not over-scheduling the child. Also, encouraging activities that help regulate quiet play, art, music, time, and nature. Mindfulness or breathing exercises can sometimes help too, basically lowering the overall stress level.
And how people react to the tics matters a lot too, I imagine.
Hugely. The sources strongly emphasize validating the child's experience and normalizing it. This means not shaming, blaming, or constantly drawing attention to the tics, especially outside of a therapy context.
Using that kind of supportive language.
Yes, like that
Yeah.
example phrase. Your brain just works a little differently. That's okay. We'll figure out how to support it. It frames it constructively. Avoid telling them to just stop.
Right. What about medication? Is that part of the toolkit?
It can be. The sources mention that medical support, usually medication, might be considered for moderate to severe kid tics, especially if they're causing pain, self-injury, or really getting in the way of school, social life, or just overall quality of life.
And those meds often target.
Often they work on that dopamine system we discussed.
Yeah.
But it's usually considered after trying behavioral approaches like CBIT. It's always a careful conversation about potential benefits versus side effects.
So behavior first, meds as an additional option if needed. What about school?
Crucial area. School and social support are vital. Educating teachers and staff is step one. Sometimes educating classmates can help too, depending on the age and situation.
And accommodations.
Yes, things like a 504 plan or an IEP can formalize support. This might mean allowing breaks to release dyssex, maybe preferential seating to reduce distractions, using a keyboard instead of handwriting if motor tics interfere, making the school environment more manageable.
This has been incredibly helpful, really clarifying. If we were to boil it down, what are the biggest takeaways from this deep dive?
I think the main points are Tourette's is fundamentally a brain-based condition affecting motor control and those filtering circuits. But importantly, how severe the Tourette tics are isn't just about the brain. It's heavily influenced by internal states like stress and the external environment, especially the support system.
And the hopeful part is that there are concrete things that help.
Absolutely. Combining understanding that psychoeducation piece with practical tools like CBIT, creating supportive, less stressful environments, and really validating the child experience, all of that empowers kids to manage their tilts much more effectively and honestly just live fuller lives. It's often not about a cure, but about reducing the impact.
Okay, so as we wrap up this deep dive on Tourette syndrome in kids, here's something to chew on. We've seen so clearly how a difference in brain wiring interacts profoundly with things like stress, environment, and support to shape the actual experience of tics.
That interplay is really striking.
So the thought to leave you with is, given this deep connection between our biology and our environment in Tourette's, what does that suggest about how we should approach any challenge, whether it's health, learning, behavior, where both our internal makeup and the external world are clearly involved?
It really pushes you to think holistically, doesn't it? That the context, the support, the environment, they aren't just extras. They're fundamental to how biological differences play out.
Yes, exactly. And just a final note for anyone listening who wants to learn more, the sources we reviewed often highlighted resources like the CDC's Tourette Syndrome Resource Center and the Tourette Association of America as great places to start.